Hi guys, I'm Alicia and this is Karen, and I'm going to be showing you the head, ears, eyes, nose, and throat demonstration. First, I start out by looking at Karen's overall size, symmetry, and shape of her head, and then I will check her scalp by parting different sections and looking for redness, lesions, or flaking. And then I'm going to palpate her scalp all around, checking for any lumps or tenderness. Then I'll move forward in checking her jaw movement by placing my hands in front of her ears and having Karen open and close. And this movement should be smooth with no pain as well. Next, I'm going to assess Karen's eyes. First, I start out by looking at her eyebrows and her eyes, checking for symmetry. And then I will inspect her eyelashes, seeing that they are evenly distributed. Next, I'm going to look at Karen's conjunctiva by pulling down on her eye and checking for color and moisture. Then I will look at Karen's sclera, seeing it should be white and clear. And then I can move on to looking at the iris, which both of them should be symmetric, and I will look for color. Then I am going to look at Karen's pupils, and I should see that they are symmetric. And then I will check for the pupillary reaction to light, which should constrict with the light. Good. Next, I'm going to check for accommodation by having Karen focus on a distant object, which her pupil should dilate, and then concentrate on a close object, and they should constrict, which they do. And lastly, I'm going to check for eye movement using the 6 points. And if you could just keep your head still and follow me with your eyes. Following. Good. Now we're going to move on to her ears. Okay, first we just want to look for alignment and position in both ears. We're also going to look for size and shape and symmetry on both sides. Then I'm going to palpate for any tenderness or edema or nodules. Good. Now I'm going to inspect the internal canal, and I'm going to do this by pulling her ear up and back. And I'm looking for any drainage, redness, swelling. I can also use an otoscope to check her tympanic membrane. Next, we are going to check for auditory acuity. And first, I'll use the whisper test, in which I stand to Karen's side and have her cover her opposite ear and have her repeat what I whispered. Baseball. Good. And you should do this test in both ears. Next, I will use a tuning fork to do the Weber test, which will test for hearing in both ears. You hear it on one side more than the other? See both sides. Good. Now I'm going to use the tuning fork to do the Rhines test, which tests hearing by using bone conduction and air conduction. Tell me when you can't hear anymore? No? You can't hear. Good. And Karen heard when the tuning fork was closest to her ear for a longer amount of time because air conduction is greater than bone conduction. Now we're going to do the nose assessment. I start this out by looking at the overall appearance of her nose. I look at symmetry and if there's any discharge and any other characteristics that she might have. Now I'm going to test for air exchange, in which I close one nostril, breathe in, good, and close the other, breathe in, good. And she has equal air exchange on both sides. Now I'm going to inspect the internal nose, looking for any drainage. I'm looking for moisture or any lesions or anything like that. Good. Now we'll move on to the mouth assessment. I start this by looking at her lips. I look at the texture and the color, symmetry of her lips, and moisture. And then I'll have Karen open her mouth, and I'll look at her teeth and her gums, and I'll check for movement of her tongue. I'll also look at the color of her tongue and the texture, and I'll look at her mucosa, just checking for color and moisture again. And finally, we're going to do the neck assessment. I just look at her neck, and I can see that it is centered I look for any masses or lumps, and then I'll do a range of motion test, having Karen look forward, up, look back, up, and to the left side, and to the right side. Good. And then I'll move to the back, checking for the thyroid gland. I'll have Karen swallow. Good. Okay, and that concludes the head, ears, eyes, nose, and throat. Thank you for watching.